Good morning. So it's day 2 and I'm on my way to my pre-op appointment so we can do blood work and everything. Hello. For Brielle?
Yeah.
Yes. And I will see you guys when I get there. Back at the ranch. So we're back. I'm in the consultation room again. I'm filling out paperwork. And then we're gonna get started with all of the procedures to lead up into the surgery. And we're all set. Surgery is paid for. Surgery is on Friday. Surgery is happening. I'm just overwhelmed with joy because this is like something I've really wanted for an extremely long time. I know I said that already, but that's how true it is because it's been a while and I haven't felt like me in a while. I'm just ready to get back to me. We're having lunch and we're at the infamous Papadeaux, honey. Get you a piece of Papadeaux. Get you a piece of on your toes. Yeah. I'm doing this. I'm gonna probably dine out every day. Because I know once I get this face done, it's over. I'm just be eating applesauce, soup, noodles. Why is this autofocus is getting on my last nerve?
We have like our Grand Hennessy over here. It'll have some orange juice in it. It has both Hennessy and Grand Marnier. Or we also have like a frozen drink.
You know what, give me the Swamp Thing large.
Swamp Thing large, yeah. The Swamp Thing is probably the fruitiest of all the drinks. It'll have both hurricane as well as frozen margarita.
Oh yes, let me get that.
Alright, so would you like the largest Swamp Thing?
Yes, grande.
Alright.
I want the whole experience. Papadeaux. This reminds me of BBQ. This is the Swamp Thing, baby. Yeah. All right, let me put her down. Cause I could, This is such a delicacy. Oh, I can't take it. This how I get full, look.
Why when your food get just go get, ooh, I'm gonna take this to go.
Mrs. To go. That's my name.
TS Takeout.
TS Takeout. TS Takeout. Mrs. To go. Oh my God. This is so sweet. Look at my earring. Are they serious? I can feel a drink. This shit is strong.
Come on.
This is the fanciest ghetto restaurant I ever been to. It's fancy as hell, but the food is given. It's Banji. But it's like high class Banji.
In the drink?
No? You don't see it?
No, I don't see it. You was out putting some of this mango tea in there, bitch. We're gonna eat that fucking shrimp.
The moment of truth.
Girl, stop playing.
It's hot. Man, it's cute, but it's hot.
1 to 10, what would you score Papadeaux?
Now that I think about it, I really don't like Papadeaux. And this is coming from TS No Tip. Honestly, I would probably rate Papadeaux. I mean, I enjoyed the food, so I would say an 8.5. What about you? What you think?
I think it's overrated.
It's overrated?
To me. Because everybody who comes to Texas is all they want to eat. And Razoo's, I feel like it's much better. Walk-ons, to me, is much better.
This gumbo is serving me right now, so y'all get
good.
So y'all got an 8.5 out of that.
After the hot.
It's over for me. What I will say is Papadeaux got me fucked up. Because this is strong. Be back, Papadeaux, we looking for a mama dough. Later. Okay, so I just came from my pre-op appointment. I just picked up my prescriptions. So I have to take these to the pharmacy so I can have these ready before it's time for me to go to surgery. Surgery is this Friday again on the 18th, I believe it is. Yes. They still haven't let me know the time. They will call me the day before and let me know when I have to come in and everything. So I'm really, like, it's really going down. Ah! It's really happening. It's going down. I also went out with my girlfriend. We had some lunch at an infamous place in Texas called Papadeaux or Papadeaux. And the food was actually good. It was B&G kind, but it was like quality B&G kind. Upscale B&G kind. High class B&G kind. And this is the sound of my lip. Yes, oh my god. But yeah, high quality B&G kind. I enjoyed that. So since I've been out here, I already ate at 2 different places. Today I'm gonna try something a little different. I'm also going to have a colonic today. Hydrotherapy colonic, which is like they shove a tube in your ass. It forces some water up your ass and pulls out all the waste. So yeah, I'm about to go do that, do a little shopping. It's the night before surgery and I just came on here to show you guys a couple things that I bought to prepare for surgery as far as like food, clothing, and the medication I was prescribed. So first I'll get started with, I guess, the food. They told me to like try my best to have a low sodium diet because the more sodium intake, the more swelling it will cause and it will be harder for the swelling to go down. Overall, some things they told me to get was like fresh or frozen vegetables, fresh poultry, fish, and lean meat. Use herbs and spices and salt-free seasoning blends. Cook rice, pasta, and hot cereal without salt. Cut back on instant or flavored rice. Pastas, cereal mixes, frozen dinners, pizzas, packaged mix, canned soups or broths, and salad dressings. These often have a lot of sodium. When available, buy low or reduced sodium or no added salt versions of food. Choose ready-to-eat breakfast cereals that are low in sodium. I had to go to the pharmacy because I've been out all day and I've been busy doing other things. What, is it blurry? So this is Chunky's little soup. This is just until I can make it to the supermarket. Then I got this as well. Chicken noodle soup, 25% less sodium. I don't know if you guys can see that. Unsweetened applesauce with natural flavors, no artificial sweeteners, 50 calories per serving. So this, and I have 3 of those. So this is just to hold me up until my caretaker can make it to the supermarket. But from there, we're gonna move on to the stuff that they requested and they required me to like come in with so I'm comfortable and, you know, not restricted. And so they told me to get some socks. I got some socks. I have a pack of these. They also come in blue and purple. They also told me to get a baby toothbrush because I'm not going to be able to open my mouth as wide. So I have me some trans colored toothbrushes, some cute little comfortable unicorn furry fluffy slippers. And then last but not least, I have the grandma nightgown. I'm gonna be wearing this to surgery so I can be comfortable when I'm getting rolled out in my wheelchair. Aside from that, I also have some hydrogen peroxide. You always want to have hydrogen peroxide whenever you're getting any surgery that's going to involve like stitches and stuff like that, because you're going to need this to clean around your stitches. Some Q-tips. I'm pretty much prepared. How do I feel at this current moment? I feel regular. I won't feel like until I'm in the actual clinic, and I'm never nervous for surgery. I'm always like more so anxious, like, but in a happy way. I'm never nervous or scared. I'm more so anxious and happy. I waited so long for this, so it's like, give it to me, baby. Yes, I am in Dallas, Texas. Surgery is tomorrow at 8 a.m. It is currently 12:05. I'm going to sleep. So after 12 o'clock, I cannot eat anything. Nothing. Because if you do, when you go on that surgery table and they put you under, all that food is going to come up. It's going to be... and they're gonna have to stop the surgery and wake you up, and then you're not gonna be able to do your surgery. You're gonna have to reschedule your surgery, because that happened to one of my friends. So it says the night before surgery, please limit your diet to bland foods. Do not consume alcoholic beverages the night before surgery. Do not eat or drink anything after midnight the night before surgery. Don't do it. You're gonna be gagging. The morning of surgery, wash your face with Cetaphil and rinse well. Wear casual or loose clothing. Something that buttons or zips in the front, i.e. jogging suit. Do not wear jeans, wear thick socks and flat shoes. Do not wear any jewelry, body piercings, or makeup. Be sure to mention if you have any dermal piercings to your pre-op nurse. No lotion, no creams, no perfumes, no deodorants should be applied the morning of surgery. The morning of surgery, brush your teeth, rinse your mouth, but do not swallow. Don't do it, girl. No gum, no mints, no candy, no nothing. Do not put nothing in your mouth. Pay it. Pay it. Don't do it. Why? Please, no. Woo. But seriously, y'all, don't do it, because once they put you, baby. So yes, that's pretty much everything. Thank you guys for watching. Thank you guys for watching. I'm gonna go to sleep. It is currently 12:08 now, 12:09 now. I just wanna go to sleep before I try to eat something, because I'm that type of girl. I will really try to eat. I like to, it's not that I like to, but I get hungry in the wee hours of the night. And sometimes I just don't know how to tell myself no. I just don't know how to do it sometimes. So I think it's best that I just go to sleep. So until tomorrow, class is done. So right now we're waiting on Dr. Raphael, because he's in surgery with someone else. I'm next in line. He's gonna mark me up and explain the procedures and how he's going to chop and screw me up. And then we will be heading off to surgery. Period. It's going down. Basement. You better hold on to your teddy. It's not me on down street. Chef cooking for me. They say my shoe game is either mental asylum looking for me. You a rookie to me. I'm in that win, being purple lamb, damn, but you been a fan. Yes, I am. I am. It's surgery day.
Yes, it's a wonderful day.
I'm excited.
Cool. I'm going to have you remove your mask.
Okay.
We're going to be doing two things today.
Okay.
One is, you see how your jaw comes down nicely, then about here it sort of rounds out. So what we're going to do is taper that down, and we're going to do that through the inside of the mouth. Now the question with this is, how dramatic do you want the shortening? In other words, some girls say, no, I want to keep it real. Others say as much as you can, somewhere in between. We'll kind of split the distance just so you can kind of curl out a bit. I think it'll be nice.
Yeah.
Sound good? Any other questions?
I'm just curious to ask how sharp this is gonna be.
Well, a couple things determine that. One is what we do to the bone.
Okay.
The other one is your soft tissue. So notice, here's your bone. If you, as you can see, that's pretty wide right there.
Yeah.
So when I'm done and you feel it, it's going to be quite a bit thinner. So you won't have this sort of squared off area. It's going to be tapered.
Yeah.
So this will be straight, but I can't control for the soft stuff. You follow me? And so for about takes about 6, 8, as many as 12 months for all of this to really go down. And the more you wear stuff and all of that will help.
Yeah.